In this video, I'm going to be talking about the top 3 myths around bariatric surgery that come up time and time again in different shades and different forms in my conversation with patients who are keen to consider weight loss surgery. The second myth is bariatric surgery is cosmetic and it is expensive. Now, let me begin by saying that the World Health Organization describes obesity as a disease. Obesity is not only a risk factor for developing diabetes, heart problems, strokes, sleep apnea, but it is a known risk factor for certain cancers, specifically prostate cancer in men and breast cancer and endometrial cancer in women, plus pancreatic cancer and liver cancer in both the genders. Now, when we talk about bariatric surgery, it is far from cosmetic surgery. Bariatric surgery or weight loss surgery has got significant medical benefits. I have addressed that in a separate video in detail, but the synopsis of this is that we know that in an individual who is struggling with weight issues, it is not just excess fat around the organs, but we know that this fat creates a state of inflammation. Inflammation is something that starts in your gut and spreads slowly around the body. There is inflammation which is measured by way of, increased inflammatory markers in the blood, which is what leads to fatty liver. It leads to cardiovascular diseases and other problems. In fact, the one thing that COVID epidemic showed to us was that the risk of mortality and the risk of requiring artificial ventilation was highest in individuals who were overweight and diabetic, primarily because they had a lot of inflammation in their body. But let's come to the medical aspect of it and the benefits of weight loss surgery on long-term survival in obese patients. And according to this study, which was published in a very reputed journal, if you see the green bars, you will see that they took 7,462 patients and they followed them for up to 10 years. And they found that percentage of mortality progressively kept increasing as the years passed by in comparison to individuals who did have bariatric surgery, that is shown in the blue chart. In another study, and sorry about the quality of the image over here, overall effect of bariatric surgery on mortality was statistically significant. To put it very simply, bariatric surgery not only adds years to your life, but it also adds life to your ears, because you can see that migraines improve, your cholesterol improves, your depression improves by 55%. As you can see, diabetes gets resolved in 80% of patients. Fatty liver gets improved in 90% of patients, and there is a 95% reported improvement in the quality of life of so many people.